Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is multi-dose vials and injection safety. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is effective dementia care techniques during a respiratory outbreak. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guest today, Ashley Belt. Ashley has been a West Virginia registered nurse since 2010. She resides in Elkins, where she attended Davis and Elkins. She obtained her associate's degree in 2009 and bachelor's degree in 2020. Through her years as a registered nurse, she has gained experience in the long-term care, outpatient, and hospital settings. She is a member of APIC and belongs to the West Virginia APIC chapter. Currently, she works for the West Virginia Department of Health on the Healthcare Associated Infections Antimicrobial Resistance Program. Ashley, thank you for joining us today.
Thank you, and welcome everyone to today's presentation. Today we're going to be talking about multi-dose vials and injection safety. We'll talk specifically about why injection safety is so important and about the things you can do to make sure you're using multi-dose vials safely. After today, you'll be able to recognize and describe the injection safety actions to take when you're using a multi-dose vial. You'll understand why the actions are so important. We're going to begin by talking about why injection safety matters so much for multi-dose vials. But first, let's start with some vocabulary. Here's the definition from the CDC for multi-dose vials. A multi-dose vial is a vial of liquid medication intended for parenteral administration, either injection or infusion, that contains more than one dose of medication. Multi-dose vials are labeled as such by the manufacturer. Also, on this slide, I attach the source for additional questions you may have about multi-dose vials. Okay, Kathy, if you want to take it away there and...
All right, I'll need you to stop sharing and then I'll pull the video up on my screen.
Okay. Okay.
All right. So everybody let me know once I hit play if you can hear the audio. And actually let me pull up my chat before. Okay, thank you.
Hi everyone, welcome back to Inside Infection Control, our video blog here at CDC's Project First Line. I'm Abby Carlson. It's wonderful to have you back with us. Today we are going to talk about multi-dose vials. Before we get started, I want to note that CDC's One and Only Injection Safety Campaign has a lot of great resources on this issue. We're going to put a link to that in the comments, so I suggest that you check all of that out. They have a lot of wonderful guidance, and we are going to today dig into that guidance a little bit and talk about why multi-dose vials are important. So many vaccines, including the current COVID-19 vaccines, come in small bottles that contain more than one dose of vaccine. We call these multiple dose or multi-dose vials. And those vials can be used to vaccinate more than one person. So the question is, why is this any different than, say, a single dose vial? Well, multi-dose vials need to be used with extra care because if anything gets inside that vial, it will get into all the doses of vaccine that are inside the vial. We call this contamination. Basically, it means that the vaccine has gotten dirty or spoiled and we can't use it anymore. And of course, we don't want to accidentally give dirty vaccine to patients and make them sick. This is actually a real problem. It happens every year in the United States, and it can be avoided with good practices. So that's what we're going to talk about today. If you think about it, we're providing vaccine to people to protect them from COVID-19. So of course we don't want to make them sick with something else because we've gotten the vaccine dirty. And that means we need to practice the best safety for the vaccine that we can. Not only that, but if vaccine gets dirty or spoiled, it has to be thrown away. And we lose doses that could have gone to patients. So we want to avoid that too. So how are multi-dose vials different from single-dose vials? Well, the biggest thing is that they're more likely to get dirty than single-dose vials because you're usually putting a needle into that bottle many times to pull out each dose for each separate vaccine that you're going to give to each patient. Each time that needle goes in, it's a risk. There are things that might be on the needle. If the needle is dirty, if the top is dirty, the needle might pick them up as it goes through the top. If the syringe is dirty, it could come through the needle and contaminate the vaccine. All of those things mean that vaccine can get dirty from that process. And then that dirty vaccine is no longer usable. This is different from things a little bit like insulin vials, which are multiple dose vials, but are vials that we use on one patient and one patient only. They have different risks, and the risks are a little more limited because we're not talking about injecting people from one vial, multiple people from one vial. We're talking about injecting one person from one vial multiple times. Slightly different, but this is one thing you might have seen in healthcare and might wonder, well, why are we doing it for one thing and not the other? Those vials are slightly different than a vaccine vial that's going to be used on multiple people. Okay, if a needle gets dirty in any way and goes into the vial, it ends up making the rest of the contents in the vial dirty. And when that happens, the vaccine in the vial can't be used. All the vaccine in the vial has to be thrown away. Well, what happens if the vaccine's used anyway, after it's gotten dirty? What if it gets injected into a patient? Patients can get sick, and they have. They've even died from this. Diseases like hepatitis and HIV can spread this way, and it's not just a problem that's about COVID-19. Every year in the US, patients get contaminated medication or contaminated vaccines from multi-dose vials, and they get sick, and they can die. And it doesn't have to happen. That's why these steps are so important. What happens if a patient gets contaminated vaccine? Well, then everyone who got a dose from that vial has to be tracked down so that we can monitor them and make sure they do okay. We have to test them to make sure they aren't infected, and we have to follow them over time. We do this for patients because we want to make sure they're as safe as they can be after something like this has happened. But it's a big deal. It's a big deal for the patients, obviously, but also for your facility, for the health department, and for the healthcare workers. So don't underestimate how big of a problem this can be and how much we need to avoid it. All right, to sum it up, we've covered multiple points about multi-dose vials and why infection control is so important for them. If you come back for part 2, we're going to show you the simple basic steps that you can take to make sure that you give this vaccine from multi-dose vials safely. In the meantime, don't hesitate to check us out online, cdc.gov/Project Firstline, or follow us up on Facebook and Twitter. We'll see you for part 2.
All right. Ashley, you could pull your screen back up.
Okay. Okay, can you guys see my screen again?
Yes.
Okay. Multi-dose vials are different from single-dose vials in several ways and require important injection safety actions. And why is that? Multi-dose vials are accessed by a new needle and syringe more than once to pull out individual doses for separate patients. Accessing the vial more than once can be an infection control issue. It is important to take injection safety actions to reduce the chance of contamination and protect patients. One of the other key messages that we have heard from Dr. Dr. Carlson is that contaminated vaccines cannot be used if a needle or syringe is reused or dirty and goes into the vial. Anything that's on the needle or syringe will get into the vial and contaminate the rest of the vaccine inside. If the vaccine is contaminated, it can't be used anymore and it has to be thrown away. Why does this matter? If a multi-dose vial is contaminated by a used needle or syringe, every patient who gets an injection from that vial after the contamination occurs could get a disease like hepatitis or HIV. Some patients have even died from hepatitis after getting a contaminated injection. If a contaminated vial is used, public health authorities need to be notified right away. That's because everyone who got a dose from that vial has to be contacted and followed so that they get the information about what happened and so they can be tested to find out whether they got infected. And finally, we don't want to throw away vaccine that could have been given to patients. Now that we understand why injection safety actions for multi-dose vials are so important, let's dive deeper into what those actions are. We're going to watch a short animated video, How Do I Safely Use a Multi-Dose Vial? So Kathy, I'm going to stop sharing again.
Okay.
Okay.
Many vaccines, including the current vaccines for COVID-19, come in small bottles with more than one dose of vaccine inside of them. These multi-dose vials are accessed multiple times to vaccinate multiple people with a fresh needle and fresh syringe every time. Using multi-dose vials safely helps ensure they don't become dirty and possibly harm people. That's why it's really important to follow injection safety steps and instructions from the vaccine maker when using a multi-dose vial. Here are 10 injection safety steps to remember when working with multi-dose vaccine vials. However, depending on the vaccine maker may recommend additional steps, so be sure to check before starting. Step 1. Always prepare multi-dose vial injections away from patient care spaces in a designated clean area. Preparing multi-dose vials in a separate space helps ensure they are handled correctly and decreases the chance for mistakes. Step 2. Clean your hands before you touch the vial so that you don't get germs from your hands onto the vial, because they could get inside the vial and contaminate the vaccine. Step 3. Check the label to make sure it is a multi-dose vaccine vial. If it's not, the vial should only be used once for a single patient. Next, confirm the vaccine is not expired. Expired vaccines may not work as well and should not be used. Step 4. Look and see if the vaccine appears the way the maker of the vaccine tells you it should. If it doesn't, or you're worried something has gotten inside the vial and made it dirty, don't use it. It could be contaminated. Step 5. Use a brand new sterile needle and brand new sterile syringe for every vaccine dose. Just using a new needle is not enough. You must use a new needle and new syringe, because if the syringe is dirty or has been used, blood can get into the vial when you draw up the vaccine, even if it looks clean, risking the spread of viruses like hepatitis C or HIV. Step 6. Disinfect the top part of the vial stopper, with an alcohol prep pad every time. There are a lot of germs on the top of the vial. If it's not clean, then when you insert the needle into the vial, germs can get pushed into the vial, contaminating it so the vaccine inside can't be used. If it is used, those germs could be injected into patients and make them sick. Step 7. Let the top dry before sticking the needle in. This gives the alcohol time to kill any germs that may be on top of the vial. Step 8. The first time you put the needle in the vial, write the date and time it was opened on the label to help prevent the vaccine from being given to a patient beyond its use date. Step 9. Follow the vaccine maker's instructions for storage and for how long you can use the vaccine after you first access the vial, which varies by product. Beyond use or improperly stored vials must be thrown away. Step 10. Never pool doses. Combining partial doses from multiple vials to make one dose for a patient can increase the risk of germs or other stuff getting into the vaccine, which can make people sick. By following injection safety steps and vaccine maker instructions every time, You will help keep yourself, your colleagues, and your patients safe.
All right, back to you, Ashley.
Okay.
That's
As you
good.
just heard, there are a few things to remember for injection safety when you're using multi-dose vials. Next, I have a few questions, and I don't know what would be best. If people want to put the comments in the chat, Kathy, if you want to watch that, or if you just want me to review the answer.
That would be great. Yeah, I'll look at the chat, and if
Okay.
anybody wants to take a couple seconds to try to answer the question.
Okay. So let's review some of these actions. First, where should multi-dose vials be prepared?
People are saying in a designated clean area, in a clean area. One person said prepare away from the patient areas.
Yes, that's right. So you want to always prepare a multi-dose vial in a space that is clean and away from patients where you can safely drop the doses and prepare the vaccine. Never bring the multi-dose vaccine vials into the patient care spaces like vaccination station where the patient is getting the shot or into a patient room. Okay. What do you want to check before using the vial?
One person said open date, discarded date. Another person said expiration date and appearance.
That's right. Check the label to make sure the vial is a multi-dose vial and that it is not expired or beyond use. If it's expired or beyond its use date, you don't want to use it. Why should you disinfect the top of the vial before inserting the needle?
Someone said to make sure there are no contaminants.
That's right. You want to disinfect the top of the vial with an alcohol prep pad to kill any germs on the top so you don't push germs into the vial when you insert the needle. You want to let the top dry before you insert the needle. Okay, and then what do you need to do the first time you open a multi-dose vaccine vial?
Label it with the date is what we're hearing in the chat.
Yes, make sure you write the time and date in the appropriate space on the label. Of course, you always want to follow the manufacturer's instructions for how long you can use the vaccine after you access it and when it should be thrown away. And then last question, what do you do if there is a little bit of vaccine left in the vial, but it's not enough for a full dose?
Hearing discard it.
That's right, you have to throw it away. We can never combine doses from different vials to make a full dose for someone or give someone less than a full dose. And this is for you guys to review, share, use in your facilities, familiarize yourself with this checklist. Um, If you would like more information or resources about the importance of using a brand new sterile needle and syringe, you can always explore CDC's resources about injection safety and their one and only injection safety campaign. These include FAQs, checklists, patient handouts, posters, and videos about injection safety and clinical practice. I hope you enjoyed today's conversation. I've captured some key takeaways here. Multi-dose vials require a specific set of safety procedures that are different from those for single-dose vials or multi-dose vials used with only one patient. Contaminated vaccines cannot be used. And last, injection safety actions are important. We've covered a lot today and there's still more to learn. You can keep exploring these topics on your own using the resources on this slide. All right.
All right, so if we're ready, we can move on to the Q&A. We have one question already. Oh, I just realized my video is not on. Do you need to write when it expires after you open it?
Yes, according to the CDC, you want to put a discard date on your multi-dose vials. They recommend 28 days, but of course you want to look at what the manufacturer guidelines says. If they say something different, then you're going to put that date on there.
Thank you. And I think someone said the same thing in the chat. They said mark the open date and the date 28 days out. So thank you for submitting that. All right, so that's all the questions we have so far. If anyone else has a question or comment, please go ahead and submit it at this time using either the chat or the Q&A tool in your Zoom menu, or you could raise your hand if you would like to ask your question out loud using the raise your hand tool. While we're waiting, I'd again like to invite everyone to next week's webinar, which is Effective Dementia Care Techniques During a Respiratory Outbreak. That will be the same time and place next Wednesday at 2 p.m. We also invite you to bring your questions to our live chats every Tuesday and Thursday at noon. One of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiative, infection control, or MDS coding. You can find the links to our live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list yet, you can email me at ccaudell@qualityinsights.org and I will get you on that list. Now I'm going to drop my information in the chat and also Ashley's in case you need to get in touch. And I also put the presentation slides in the chat for anyone who wants to download those and see those resources that were linked on those slides. Now let's see, I don't think I see any other questions. Liz Dack put in the chat additional information for the OEPS website for our West Virginia partners. Let's see, and do we have any questions? No questions so far. Oh, I do see a hand raised though. Cindy, did you have something you wanted to say?
Oh, I just wanted to add that 10 steps for multi-dose vials is downloadable from Project First Line in a poster size that you could put in your med room or med cart or whatever.
Thank you, Cindy. And let's see. All right, Liz is putting some more good resources down there in the chat. So everybody keep an eye on that. And actually, I will be emailing later this week to send the recording and the presentation slides to everybody using the email that you used to register. So I will put these links in there as well if they are not already included on that slide deck. And Liz has her hand raised.
I just wanted to make a comment that when you are dealing with multi-dose vials, that you need to check your manufacturer's instructions for how long they can be used after they're opened. There's sometimes there's some that are past the 28 days or such, or less than.
All right, thank you, Liz. And I'm going to check the chat one more time. I don't think I see any questions. Ashley or anyone else on our panel, do you have anything else you'd like to add before we wrap up?
I don't think.
All right, thank you. In that case, I will go ahead and wrap this up. Before we sign off, we'd like to ask everyone here to please answer a short evaluation about today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we'd appreciate it. Ashley, I'd like to thank you for joining us today and for this great presentation. And I'd like to thank everybody here for coming this week, and we hope to see you again soon.